And it seems as though it's just, some of these are just problems with how complex of a society we're becoming. The advance in technology, where everything was all good. We're all excited about these new innovations, just to come and find out that they harm us later on.
It has been such a heated topic is because when you're talking about abortion, you're not thinking about how that affects creating life. And that's, we're building families. We're not out here. None of the patients that I talk to are wanting to go get an abortion. They want to be pregnant and have babies. And yet the government steps in, and if they don't define things correctly, they can interfere in their process and their right to have the family that they want.
Can we dive deeper into the therapies for male fertility? Spending again from what you can do at home, if I understand correctly, that's like environmental stuff. And there's still some stuff that you can get once you go to the clinic that can help you boost fertility as well.
Mm. Yeah, there are more and more treatment options available now for men. So as we mentioned, those lifestyle changes are critical. The supplements play a role. But there's medications now that you could take orally to see if it actually impacts it, especially if, and so there's like some that'll ring off, like clomiphene is a big one that more and more men are now taking, and it's still off-label use, but it's showing evidence of improving. It's probably the best of all the different types of oral medication or injectables. And then from there, there's also some certain procedures that men could take or do by a trained urologist usually that can hopefully address the issue. So varicose repair would be a big one that a lot of people end up doing after, a semen analysis and a physical assessment. So that could be one, or there's a procedure where they're extracting it from your testes. And so there are procedures like that they can do that will get you hopefully to improve what's going on with your body, or get you closer to getting pregnant through like artificial, like ART. I don't know if there's any other ones that I'm missing.
So I think the only other thing that I can think of, and I mean, again, I'm not a urologist, so this is just the only other thing I saw in the IVF clinic, would be what's called a retrograde. So sometimes, this is not very common, but sometimes the sperm is actually released into the urine. So then there's nothing in the seminal fluid. But if you were to collect the urine sample right after, one had ejaculated, you can pull the sperm from that. So that would be the only other thing that I would say that I've seen.
Yeah. And then the last thing I'll add is that there are treatments that you can do that may not address the guy's production or ability to, but will get you closer to getting the female pregnant. So one would be like IUI, intrauterine insemination, where they are collecting the sperm and then injecting it into the woman, and then that way hopefully has a better chance getting pregnant. Or IVF, which is, getting the sperm and the egg into the lab and trying to see if it grows there and then implanting it back in. So those are other ways that if there is issues like low count, that could give you a good chance of getting pregnant. So there's so many different options to either improve your body or your body's chance of producing and having good sperm health and quality, or there's technology that can help you get to that end goal.
And kind of getting back to the cost being a barrier, if I'm understanding correctly as well, when it comes to fertility care, a lot of this is funded out of pocket for people. And so Can you talk about that particular barrier, and is there any particular countries that are leading in relieving some of these barriers for people?
Well, we'll see if Trump follows through with what he said, but right now the US is not leading there. Even Canada is not leading. In Canada, they even recently in certain places like in BC, they've added that you get one cycle for free or covered, but it's still a lot of hoops that you got to jump through. Countries wise, I'm trying to think of anyone. It's probably Israel. Because I think they cover, correct me if I'm wrong, April, multiple cycles by the government. So there's no cost to the patient, maybe some on the medication, but even then it's reasonable.
And when you say multiple cycle or single cycle, can you elaborate on that a little bit?
Yeah. So Multiple cycle can mean a couple of different things, because when you do a egg retrieval, doing IVF, then you can create lots of embryos depending on how many eggs you got, how much sperm you had. So once you create the embryos, you can put some back into the uterus, but then you have some left over so that you can freeze them and you can do what's called a frozen embryo transfer in the future. So one cycle can actually lead to several transfers. So it could result in, more than one child, but multiple cycles, I would consider that to be multiple retrievals. So it just, you kind of have to explain what kind of cycle you're talking about, because if you're just going off of any time you attempt pregnancy, that could be retrievals and transfers, because one retrieval could result in several transfers.
And just to understand correctly, because when we hear about this, it's mostly from the perspective of abortion and the whole debate with that. But when we're talking about reproductive care, the other side of it is also
life.
And so, and both of them, like clinic like yours, April, if I understand correctly, are dealing with both aspects, if that's correct. And can you elaborate on that a little bit more, the connection there? Because I think the focus is always more on one side and we don't see the flip side of it. So defunding one, like you think you're defunding or funding an abortion program, but you're also defunding or funding something, fertility, related to fertility. Is that correct?
Still on how you define everything, right? So it's about how you're defining when life occurs. It's about how you're defining what's an embryo. When do you consider it a child or a baby? So it's going to all depend on those definitions, because if you define life occurring at fertilization, then all of the embryos that are inside a lab, that would be considered in that. And so when you say you cannot destroy any of those, there are lots of those that aren't viable. And so, if you have all of these frozen embryos that maybe aren't genetically normal, they've been tested and they're not genetically normal. If you don't define things correctly, then you create a really big problem, because, I know in some previous things they were trying to define certain things that would end up, if, let's just say, a clinic in the past had an issue with the tank and the tank malfunctioned and they lost all the embryos inside. If there are 300 embryos in there, that would have been 300 counts of murder. Like, no one murdered them. Like, that was an accident and it wasn't. So it's all in how you define it. It's very complicated. And I think that's why it has been such a heated topic, is because when you're talking about abortion, you're not thinking about how that affects creating life. And that's, we're building families. We're not out here. None of the patients that I talk to are wanting to go get an abortion. Like, they want to be pregnant and have babies. And yet the government steps in, and if they don't define things correctly, they can interfere in their process and their right to have the family that they want.
That's very powerful. Thank you for clarifying that.